and wholeness because I like to take a holistic approach because I believe medicine doesn't make you well. Medicine may treat a disease, but it may not cure, right? And so a lot of times, if we really get down to all the factors that are playing a role in our lives and how we show up and what we eat and how we move, all that can play a factor in whether or not we are healthy or not.
Mhm. Yes. So you talked a little bit when we spoke on the phone, you
Mhm.
talked about the fact that most of your patients are women. So do you cater, are your services for women or do you accept male patients as well?
Mhm. So
Do you
I
see
accept
children?
I see everyone, women, men, and children, but I do focus in on women because the woman I feel is the center of everyone, of the household, of the community, of the world. And if you really think about it, when you think about the men and the children, it's usually the woman that brings them in to the clinic, or at least, coerces them, pressures them, nags
Mm,
them to come in
mhm.
and to get seen. But more than that, I would say generally by nature, women are the people who just naturally serve others, and a lot of times, unfortunately, at the expense of themselves. And so I'm committed to serving the people who serve everyone else, to making sure that somebody is looking out for the people who are not looking out for themselves because they're so busy taking care of everyone else around them.
Yes. And so this month actually is Men's Health Month.
Mhm.
And you said something special just then. I didn't think about that when I put things out about men's health. Really talk to the women about getting the men that they know involved with their health, being more proactive to preventing disease by going to the doctor for wellness checks. In your clinic, what special services do you have that are specifically for women?
So I treat all the things, but I do take care of perimenopause, menopause, and like I said, I look at the big picture. There's a lot of treatments that have not yet been FDA approved for women because of the lack of historical research done. And I'll say that for another day. But so I tend to do more of a clinical approach, and also because I'm not billing insurance and focusing on what insurance wants me to do, I'm able to have a discussion with them and decide, okay, do we want to do these labs? I have discounted lab prices so you can know exactly what you're going to be charged for them versus whether insurance will decide whether or not they want to pay for it or not, and then you get a surprise bill for $1,000 for labs that only cost
Oh
$100.
my God. Oh my God.
so,
Wondering
so
why am I paying insurance in the first place? Yes, I
yeah,
love it.
I mean, insurance serves a purpose, but like I said, the way my clinic is set up, I'm talking to the patient, and I'm focused on the relationship with the patient and not what the check boxes that insurance wants me to check because they need it this way in order to pay for this. And I don't worry about that, right? I worry about what's going on with the patient and what do they need and how much time do they need. I have more, have more of that time with the direct primary care setup.
Dr. Hall, I do want to talk about your membership-based clinic,
Mhm.
but I want to go a little bit into you said perimenopause and menopause.
Mhm.
I think that's something, trendy right
Yes,
now, right?
yes.
And I don't know if
It's
it's
an
my
actual
algorithm.
club.
You know how you click on one video and now your algorithm is all about, I'm like,
Mhm.
did I click something? But I see it all over social media. And so, in being a woman that is aging gracefully, right?
Mhm. Yes.
In foreseeing that era of my life, or that part of my life coming, and I know that it is a real thing.
Mhm.
For me, and I think I speak for other young women, late 30s, early 40s. It does get, it gets scary when you think about perimenopause and menopause, and not scary as in this is painful, but just scary as in here's a whole nother transition of life. Or it might make, I know for me it kind of put me on a path of I need to hurry up and do some things, and
Mm.
not just about women things, but it just really makes me feel rushed. Do you find that there's a some mental awareness that needs to go on around women that are coming into their perimenopausal years or menopausal years?
Oh, absolutely. And I love that it's trending now because I don't really recall a lot of like community conversations about it when we were younger. Um, yeah, and it just everybody's like, where, they're glad the information is out now, but where has it been? So I love all the conversations and all the awareness around the symptoms and realizing, oh wait, this isn't normal, or it doesn't have to be this way. There are treatments and supplements and things that are available, but yeah, there's definitely the mental component that I don't think is talked about enough, because you usually hear, oh yeah, hot flashes and night sweats, but then there's
Mhm.
also mood changes. The good part about it is they say once you hit 40, you just kind of don't care as much about what people think about you. Well, that's a part of
Yes.
that perimenopause kicking in. Is just like,
Really?
yes, like that, just that extra confidence and not really caring as much about outside opinions. But then you also have, depression and anxiety and
Mhm.
mood swings and, the brain fog, decreased concentration. And we don't really think about that can affect how we show up at work, right?
Mm.
Sometimes, and we're not the only ones going through. Men have their version too, but understanding
Really?
they
Now
do.
that I do want to hear more about. I think for Men's Health
We are
Month.
not alone. They going through it too, um but yeah, I do think we do need to kind of really think about, okay, how is this affecting how I think and how I feel outside
Mhm.
of my physical body, more inside of my mind, and then how that relates to how you feel about yourself, um, and understanding that you don't just have to go through it. You don't have to, be more
Mhm.
irritable with the people around you, fighting at home or at work, or things like that. But yeah, that there's things available. But speaking about the men's side,
Yes. I'd
similar
go in, please
symptoms.
go straight into that. Well, let me stop here. I
Okay.
know that well, I know when my first wellness check
Mm-hmm.
after I turned 40, that
Mm-hmm.
had to be the most stressful wellness visit I've ever had. And I say that for me because I've been always been, relatively healthy, being a trainer and being in the health and fitness realm. So to go
Mm-hmm.
to the doctor's office at 40 and things are starting, numbers are off, and
Mm-hmm.
then they start to tell you, well, you are at that age and to expect this and expect that. When I left, I remember I had a little bit of heart palpitations and I was breathing a little hard and I got a little anxious about life and have I done the things that I wanted to do as a young person?
Mm-hmm.
And then it spilled over into me thinking about my finances, not just about my body, but just thinking about life in general. So I did always wonder. I said, and I took that time and I said, you know what? I said, I feel like there's a mental component because I couldn't imagine just being a woman and going through hot flashes. And when someone asks you to go somewhere, being self conscious about, oh, do I really want to go? It kind of reminds me, just the aging process in general about
Mm-hmm.
how a lot of people step back from social interactions because of the things, their changes that their bodies are going through as we age. So
Yeah.
I did want to make sure that I do put that out there. I like to make sure that I do put out the mental awareness aspect
Mm-hmm.
of everything that we do and how people need to be aware of themselves
Mm-hmm.
mentally. So
Mm-hmm.
making that statement, let's mosey right along to the men's
Yeah.
is it men's menopause? What is
It's
the
it's
terms for that?
andropause.
Andropause.
Andropause. Andropause.
Andropause. Okay.
Mhm. And while our estrogen and progesterone are kind of decreasing, their testosterone is
Mm-hmm.
dropping. And so they can have some of the same symptoms, the fatigue, weakness, brain fog, decreased concentration, um, mood changes, even hot flashes sometimes. Um, and you know, but the thing that brings them in, they don't usually complain about that stuff. They're talking about their libido and their erections.
Mm.
And you know, women have sexual side effects too, but a lot of times they don't feel comfortable mentioning them, unfortunately. And I would encourage any woman to think about all the things that are going on with you. If there's any changes in your body, you know, feel don't feel afraid to share that with your physician. And hopefully more physicians and providers will start to just voluntarily ask about these things to
Mm-hmm.
help open up that door for that conversation. um, I think it's necessary to know that, again, that's a part of the holistic approach, because sexual health as well.
It is.
It's a part of, you know, the human experience,
Mm-hmm.
and we should be comfortable talking about those things.
So for men, when it comes to andropause for
Mhm.
men, you said that they can have some of the same symptoms as women: brain fog, mood swings, hot flashes, all those things. Do you find that men have those symptoms before they notice the change in their libido, or does the libido come first, or it could be either or?
That's a great question, because honestly, the men, you know, that's something that's the men never talk about the other things when it comes to my interactions with my patients. It's been mostly like fatigue,
Mm-hmm.
and I think that would probably come first, some of the fatigue, but they'll notice, you know, just not having the energy, they kind of get up and go. They'll start to notice having less of those early morning erections,
Mm-hmm.
and more difficulty with their libido and with intercourse and things. And so I think the fatigue will kind of be the first thing that shows up.
So if a man were to go to the doctor when he starts to, notice some of these different signs and symptoms,
Hmm.
is there a medication or is there treatment that can prevent the decrease in sex drive? Or
So they would typically get an early morning testosterone level check,
mm-hmm,
and if that is in a range where the physician deems it treatable, then they may get testosterone replacement.
mm-hmm,
Sometimes they may start having some of the symptoms before the testosterone is low enough to treat, and so they may just be treating the libido and the erection, you know, like things with like Viagra and Cialis, things like that.
right.
Hmm.
So, and I ask those questions because with it being Men's Health Month, and we
Hmm.
know that men are less likely to go to the doctor unless there's something actually wrong, then maybe this is something that can get
Oh,
men to go to the doctor. So there's
when
always a
I
method to my questions.
When
So
I say it's one of the main things that will
yes.
get them there, I've had patients that had uncontrolled diabetes, uncontrolled high blood pressure, and the only thing they cared about was, were they going to get a medicine for the erectile dysfunction.
So man, there it is. Go to the doctor. If you notice that your body temperature is changing, you notice brain fog, start paying attention. I mean, even with your blood pressure being off, those type of things, just feeling weird, feeling different. If
Mhm,
you're a man that's 40 and older, specifically,
mhm,
for andropause,
mhm.
go to the doctor, and that way you can catch the issues before you get to that stage in life where it starts to affect your libido. So we want
Mhm.
to catch that early, and I'm speaking that as if I'm speaking for the
Absolutely.
men's
Yes.
community.
Yes.
So men, get
Men
to the
don't
doctor,
get
get your
that.
wellness checks, get everything checked out. If
Mhm.
anything feels off, make an appointment with your family doctor. I
Yes.
want
And I
to
want to
go.
add, I'm
Go
sorry, I
ahead.
want to add one more thing.
Mhm.
That uncontrolled diabetes and uncontrolled high blood pressure can accelerate erectile dysfunction. It can be a cause of it. And then also too, sometimes people are afraid, well, medication can affect that as well.
Mhm.
You just have to have open back and forth communication with your physician or provider about side effects from any medication you're taking. Don't just assume like, oh, this is just a part of it, I have to deal with it. Well, maybe not. There may be an alternative medication or something else that could be done about whatever that side effect is. And so I think too many people just take what they're given and don't communicate, or they may just stop taking it because of the side effect and not
Mhm.
communicate that, hey, this is not working for me.
So, as you speak about medication, I know I mentioned off camera, I did ask you about herbs.
Mm-hmm.
I know that I have gotten to where I'm looking at more natural ways of just living my life in general,
Mm-hmm.
all the way down to the detergents that I use to wash my clothes or where I purchase my clothes and what chemicals they use to
Mm-hmm.
manufacture my clothes. As a woman, with women, we have things such as fibroids, we have things, menopause, perimenopause, right? Are there any herbs out there or any natural remedies that you know of that a woman can try naturally before it gets to a phase where she feels like, hey, I'm noticing some things differently? Are there some herbal paths that you can recommend for patients to take or
Mm-hmm.
for women?
So I would say I'm all about herbal remedies. I just don't have personally a whole lot of education in it, and so I typically go case by case and kind of look into or they may patient may bring me some information or ask me about a certain thing, and I'm like, okay, well, let's look into it and see what's out there. But I love the idea of doing natural and herbal supplements. Now, so there are things that have been tried and true over time, like black cohosh for for menopausal symptoms and things like that. But the thing about the herbs and supplements is that there can be some activity or reactivity interactions with medications. And so it
Mm,
is good that you tell your doctor all the things that you're taking, because they're like, what medicines you're taking. Some people say, oh, none. And then they have like 20 supplements that they're taking, and it
mhm,
may interfere with the medication. And so making sure that they have all the information to know, okay, well, they may not tell you to stop taking a supplement, but they may choose a different medication based on the supplement that you're taking, or things like that. Some of them are not. There hasn't been a lot of traditional scientific research, and some have, and some we just kind of go, well, Big Mama did it and it worked, and
mhm,
so we're gonna keep doing it. But now with more information, we're able to realize, oh, it worked for Big Mama because, and then
mhm.
we're able to, explain why it was that it worked. So yeah, I'm open to it. I just don't have a whole lot of. They don't teach it in med school, so I'm looking forward with more time on my hands to get into that more. But definitely, food is medicine. I'd say
Mhm.
food first. If we're eating our colors and getting enough nutrition, we don't typically require a lot of the supplemental things.
So, and I'm glad you said this, the things you said, because I know as a general population, lay people out here, we tend to think that because it's an herb, it will not have a side effect to my
Mhm.
medication. That's kind of the blanket thought. You think,
Yeah.
oh, it's natural. I've heard people say, they get these supplements and they read them, and someone might say, is there a side effect? And they say, oh, it's all natural, and they don't even think about it. So I'm so glad you said
Yeah,
that, because
absolutely.
supplements can have a
Hmm.
side it can have a contraindication
Hmm.
or a side effect, or it can react in a negative way to your current medication that you're taking. I
Hmm.
want to roll into, I want to talk about your membership based clinic. I
Hmm.
think that is very interesting. I know when I lived in Oxford, I remember the first time I saw $49 to go to the doctor. And I
Hmm.
didn't quite understand. I thought maybe it was a particular services that they had, or what
Hmm.
was that? Maybe it was, this was 20 years ago I'm talking about, but
Hmm.
maybe that was the weight loss thing, or, what was that? So can you tell me a little bit more about why you decided to go to a membership-based platform when it comes to your clinic?
Absolutely. So my clinic is set up as a direct primary care clinic. And essentially, like you said, it's membership based. Think about paying membership to a gym. So instead of like traditionally, you pay your insurance and then you get to the doctor's office and you pay your copay.
Mhm.
So there's no copays. The membership fee covers your treatment in terms of the visits and the communication, things like that. And the reason I chose direct primary care is again because of it being relationship based. I thought, okay, this is how I envisioned medicine to be between the physician and the patient. And
Mhm.
we decide, of course, evidence based medicine, but we decide what it is that is within their best interest. And the visit isn't dictated, the length of the visit isn't dictated by how much insurance is going to pay me. And
Mhm.
so I'm able to spend more time speaking to the patient instead of trying to document everything the insurance company decides that they want in order to pay for the bill. And so, yeah, like I said, because I'm not focused on what insurance wants, I'm more focused on what the patient wants. We have more time to get into actually all the factors that are involved in what they may be feeling or going through, or why their diabetes isn't controlled, or why they've gained weight. We talk about family, we talk about history, we talk about what's going on at the job. We talk about all the things that play a part in our existence because it all plays a part in our health.
Mhm. So you mentioned you could spend more time with patients. Now, I have worked in the healthcare industry. I'm not a provider, I'm not a nurse, but I've worked in a healthcare setting, and patients don't always appreciate time being taken. Do you ever run into that? Do you ever run into patients saying, "Oh, I've been here too long"?
I haven't. I haven't.
You have not.
I have
You think
not.
that's because are you branded as you come in and it's going to take some time, or do you let them know in the beginning? How do you combat that? Because I hear quite a few doctors
Yeah.
um talk about how their patients get upset because they're at the doctor's office too long.
I think they're getting upset because they're at the office that long, that they're not spending the time with the physician that long. So we do appointment only. And I have room worked in for when I have patients that need to be seen urgently. But
Hmm.
they come in, I call it, there's a no waiting room. They come in, they get checked in, they come right back, they get their vital signs, and they might get a body composition analysis, you know, um, they get all that stuff, and then I go right in, and then we talk. And sometimes it's me, doing medicine, and honestly, sometimes it's just us talking about life. My patients know I'm a Christian, and if and I don't push religion, but if they know that and they know that it's open, we may talk about Jesus. We may
Hmm.
we may talk about we may talk about who pissed them off that morning, and that's why their blood pressure is up. And so we have the time to get into all the things. And so the first visit is usually the longest, and after that we know each other, and we kind of I have a background of kind of what the problems is, what the problems are. We then it's the follow-ups aren't don't take as long. And we work the follow-up visits into their life. So say you have a yeast infection, you don't want to spend half your day at the doctor's office to get that treated. Text me.
Right.
you
Huh.
know yeah, so they may text something simple, or hey, I have a question about this medicine. The other added benefit is direct access through our text and app system.
Okay, I love that. So when you hear a membership-based platform at the doctor,
Hmm.
I'm gonna think, oh, I can go to the doctor for anything at all, anything and everything. Let me go over here to Dr. Hall, and it's
Hmm.
just gonna be that one flat fee for that month, and I've already paid my membership.
Hmm.
So tell me, what exactly do you get for your membership price? Is
So,
it,
mhm.
uh-huh. Go ahead, go ahead.
Yeah, so they for the membership price, they get unlimited visits. So that visit may be in person, it may be, telemedicine, it may be a phone call, a text. However, it works into their lifestyle and into the schedule. We make sure they get what they need. We try to handle a lot of things that they would normally go to the urgent care for.
Mhm.
Obviously, emergencies go to the emergency room. But they cut their finger. I'm able to stitch them up. And so they may pay a little bit um, out of pocket for an extra medicine given in the clinic or a procedure given in the clinic. But I think the beauty about how we do things, there are no surprise visits. You don't have to bill insurance and wonder what they're going to pay and what you're going to have to pay out of pocket. They know up front, oh, you want this procedure, it's going to cost, this much. And honestly, a lot of the procedures are kind of, one procedure a year is kind of on the house, right? And so
So
they
you
also
have a wait a minute. So you have a monthly membership and you give away one procedure on the house?
Yeah, if it's like a minor, like, oh, they have an abscess,
Uh-huh.
take care of it, follow it up, or you need some stitches.
I
I mean,
love
I'm
it. You're out here doing God's work. I love
I'm
it.
trying. I'm
As
trying.
a provider, do you find that the membership based your model, is it less stressful as a provider than it
Oh,
is to build
absolutely.
insurance?
It's when I first did it, I just immediately it was just like peaceful.
Mhm.
Because when you're in traditional medicine and they're getting paid first, fee for service. If when
Mhm.
you show up, they're stacking people 15 minutes at a time, right? And then by the time you get in there, you might only have 3 minutes left. And then if you're like me, you kind of ignore that 3 minutes because I'm gonna do what I need to do. And so I was always behind, and my patients were waiting, but they understood when it was their turn, it was their turn. And so, but
Mhm.
I still felt bad, like, oh, they're waiting on me because it just snowballs. Because 15 minutes isn't it's not enough time.
It's
Um,
not enough time.
and so, yeah, I can't remember what your question was, but
Well, no, I just wondering if it was less stressful. I mean, because
absolutely.
I know, like I said, I have worked within the healthcare industry, and the billing part is
Hmm.
the part that really I had to take a step back, right? I had to take a step back. It's like you find there's a newfound respect for healthcare providers because you just might not get paid for seeing somebody, or for if you do take that extra time, and let's say your patients are stacked up and they are getting upset and you are frustrated because of that, you just might not even get paid for what you did that day, depending on that insurance and what updates they sent that
Hmm.
last week that you
Hmm.
weren't aware of. And did
Right.
you read your contract? And did you cross the T and put the number in this box and not that box? So I was just, for me, I guess I'm wondering, is this where, paying for healthcare, is this an avenue that really might have a good chance of opening up specifically for the sake of providers being able to provide quality healthcare? So do you see this as an avenue in the future?
Absolutely. It's been, can't remember the exact history, but it's probably been around for 20 years, and I would say over the last 5 years, it's skyrocketed. And 'cause a lot of physicians are burnout. Just with the system is is not it's not built for the patient or the provider. And I won't get into all the things, but the direct primary care,
Yeah.
again, it's it's better for the patient and it's better for the physician because we're not rushed, right? And if I need to figure out what kind of rare thing you have going on, I got time to look it up, right? Or I can reach out to my network of other direct primary care providers and doctors and see, what their experience is, because we're not we're like, as we're out here, and it's so collegial, like there's no competition. It's just a different way of doing medicine. And you think we have smaller panels, but the quality of the care that we're able to give, because we're able to give more time and attention. It's just, I mean, I wish everybody was doing it.
What was your biggest challenge when you made that switch from insurance payers to membership based?
I would say my biggest challenge was being completely immersed in being an entrepreneur.
Mm.
It's the business, right?
Mhm.
It's all the business. I've had a business before, but it's different working in the business and on the business, and
Mhm.
not allowing your altruism to win over, because you still have to pay the bills.
Mhm.
A lot of doctors, they would do it for free, but that doesn't pay any bills, and that doesn't increase the impact you have to do more good work. And so, but yeah, I would say it's the business, learning the business and sticking to the business, and understanding that you can't give it away.
Yeah, I think that might be the biggest challenge for anyone who tries to turn their passion and purpose into their profession or where they actually make their main source of income is that you don't think about the business. I know being a personal trainer, when you
Mhm.
go outside of a gym, you don't think about, oh, who's QuickBooks? What is that? You're like, wait, I didn't
What
know
is
all
CR?
these things are involved. I have to do an annual filing. That sounds so hard. I need to hire someone, and then you just find out you log in and click a button. So I think that that is a challenge for most people who turn their passion into their main
Mm,
source of income. I want to go now into the weight loss. So you were a weight loss doctor. Is that the correct title for? Okay.
mhm,
So many people do struggle with their weight, myself included. As I've gotten older, it has become a little more challenging to get
mhm,
to that, or you just have to, I have to, it's like I have to accept myself as a new person, as an older woman, and not that same size girl that I was at 20. But we're
mhm.
not talking about me right now. So people who struggling with their weight, they might feel like they've tried everything. How do you help patients to lose weight and keep it off? What are your, let's just start with the basis. What do you do?
I First, we take an assessment,
Hmm.
and the same things I assess are the same main four things that I address. I call them a four-factor fix. Um, and that's on top of the traditional, like your medical problems, your family history, all that stuff. And then it's food. What are you
Hmm.
eating? When are you eating it? Are you having cravings? Are you hungry? Are you not hungry? Because a lot of people assume people that are overweight are hungry all the time, and that's just not true.
Hmm.
Different things for different people. The second one is activity. How are you moving your body? Are you moving your body? Um, Besides just the things that you have to do, and then there's stress. Chronic stress, how you deal with stress, plays a big role in weight gain or the inability to lose weight. Right? Everybody throws that cortisol word around all the time. Um,
Hmm.
and so when you're stressed out, and then the fourth one, sleep. Right, when you're stressed out and you're not sleeping, those cortisol levels are elevated, and your body does not want to let go of weight. And so we talk about all those things, and we get into, okay, what's stressing you out, what do you do when you're stressed, are you on any medications for anxiety or depression? Sometimes medications can cause weight gain, right?
Mhm.
Perimenopause, changes with medications and hormones and new job. You went from you went from running around, um, in the plant to being the manager that sits at the desk, or the supervisor. You go from moving around to desk work. That plays a role in what's happening with the weight. And so I talk about all the things again, a holistic approach about um, the different things that can play a part in the weight.
So do you write prescriptions for, the weight loss drugs and things such as that? So when
Absolutely.
you write these prescriptions, because that's one thing, we all know, you go to the doctor, you tell them what's on.
Hmm.
But what do you do special for those patients once they've received the weight loss drug or once they've reached their goals? What's after that? Because that seems to be where the part no one wants to really talk about as of right now. It's a big
Hmm.
trend to do the weight loss drugs. But
Then
myself being in that, yeah, being in the health and fitness field, the first thing when I first heard about all of it, I was like, yeah, but what's afterwards? People are
Mhm.
not talking about that. So what do
Yes,
you do special for your patients afterwards?
sure. Honestly, the same thing I do at the start. I I talk to them about nutrition, about getting their protein in, about getting a well balanced diet, getting their vitamins and nutrients, and decreasing the carbs, and, like, cutting out the things that we know are not healthy for, and not like eliminating. My approach is more of, this is a lifestyle change. This is a journey. Like, you can cut everything out cold turkey now, but then again, in 6 months, then what? When you really want the mac and cheese and the cake, then what? And
Mhm.
so my approach is moderation over restriction, and progress over perfection. And so we talk about the food, and I have access to dietitians. We talk about the movement, and we kind of start where you are, and I again, it's a fitting it into the lifestyle. So 10-minute approach is my thing.
Mhm.
Are you completely inactive? All right, let's try 10 minutes a day. Right, become the person that works out daily, or at least
Mhm.
5 days a week. Now, what you do with that 10 minutes, it's gonna improve, right? But at least you're building that muscle, that habit. That I work
Mhm.
out, more days than I don't. And then as you continue, then you increase it, and you get better. And so when we talk about the medications, we talk about, you have to get that protein in, get the collagen in. You don't want those in big face, what they call. So you want to make sure you're hydrating, and that you're moisturizing, sunscreen. But the body naturally wants to go back to the heavier version, right? There's this, I call it a metabolic mix match.
Oh, talk more. I've
There's
never heard that.
there's another way to say it, but metabolic dysfunction,
Mhm.
where people who are at unhealthy weights, um, they as you lose the weight, your body, like, instead of it saying, oh, okay, yeah, we're at this unhealthy weight, and we need to eat less, and we need to move more. It does the
Mhm.
exact opposite. The more adipose and fat tissue you have on board, the more your body will say, oh, we need to conserve our energy, and so you're tired all the time. Oh,
Mm.
and you need to eat more, and so it may be an increased appetite, or maybe increased cravings. It doesn't happen this way for everybody, but there's some sort of thing where you would think your body notices, oh, we shouldn't be at this weight, so let's do this thing to improve it, and it does not do that. And so you process sugars and things differently. And so when you lose the weight, then your body naturally, you'll get, everybody gets to that plateau, right? Where you're
Right.
losing, and then your body's like, halt, right? And you
We
have to do
good.
something
We good
different,
right here.
right? And if you're not actively trying to lose more, then you're like gaining the weight back. And so I think the first thing people get a sigh of relief realizing it's not just your fault. Your body is literally fighting against you. And then you become weaker when you lose the weight because you're no longer, you might, if you lost 50 pounds, think about lifting 50 pounds and then you go to just, you know, um,
Mm-hmm.
just your own body weight or gravity, right? So your body gets weaker. And so the metabolism drops.
Hmm.
And so I'm oversimplifying a lot of sciences that's happening in the body, but essentially your body's fighting against you and it wants to gain the weight back. So when people are like, oh, she lost all that weight and she gained it back, like, yeah, that's science, right? That's
Hmm.
metabolic dysfunction. And she could have been doing everything right. But most of the time we're not doing everything right because those thoughts come back, the cravings come back, right? The food noise comes back. And the people who say they just eat right and exercise, there's so many more factors at play when it comes to obesity
Hmm.
that we have no control over. And so eating right and exercising is, this much of it. And so that's why people are noticing the big change that's happened. Oh, these drugs are on board. And so back to the maintenance with the drugs, some people, they can get on the medicines for short term, body kicks in, and they're back on track and they can maintain with diet and exercise.
Hmm.
But majority of the people in some capacity will need it, especially like the GLP-1s will need it in some form, whether it's, continuing a smaller dose every week or stretching
So
it out. It just depends on the person. I don't think all the studies have been done, so it's been my clinical assessment.
So are you saying that some people, when they get on the, we're not even going to call it a specific name because there's so many different types of
Right.
weight loss drugs, but when they get on a weight loss drug, they just might have to stay on it once they've gotten to their weight loss goal, just so that they
Mhm.
can maintain that weight
Right.
because their
Mhm.
body naturally wants to perform the activities and have that mind muscle memory
Mm.
to live that lifestyle that had them to gain the weight in the first
Obes-
place.
Obesity is a chronic medical condition, just like diabetes,
Now,
just
what
like
insurance
high
won't pay for that then?
blood pressure. they're
I'm sorry.
starting. They're starting to. They're
I'm
starting
sorry.
to.
Okay, I get a
But
little
it's
touchy.
taking it's taking way too long, right? But the system is doing its thing, right? But because if we treated obesity, we wouldn't have as much diabetes, we wouldn't have as much heart disease, as much blood pressure, as much sleep apnea, as much cancer. There's so many things that are directly correlated to obesity. And if we get on to treating the obesity and developing healthier lifestyles and not just losing the weight, like that's a portion of it, but
Mhm.
everybody that's at a healthy weight is not healthy. um
Right.
right, you could take the medicine and lose weight and then what,
Mhm.
right? It's
Mhm.
the are you eating right, are you moving your body, um and are you treating anything else that may be happening as well?
S- Okay, so here we go. All right. So when we talk about obesity, let me ask you this. Do you find that it is more challenging or less challenging for a person who, because, and I'm asking this for a reason, a person who has been, let's say, obese for the
Mhm,
majority of their life
mhm.
versus someone who gained 50 pounds over the past 2 or 3 years and they're trying to lose that 50 pounds. Do you find it more difficult for one or the other person to achieve a weight loss goal?
I would short answer yes. But honestly, it's really individualized. But yet, for those who have genetics, a large piece of genetics, a genetic factor, uh, they they may have more difficulty, because in addition to um, being treated with medication or things like that, having a lifestyle that's contributed to, especially if they're raised where they don't habits of not eating very well, or not really having exercise being a part of anybody's normal activity. They're they're fighting to understand a new way of living, especially if they've
Mhm.
lived this way for 40 years. And then now you're telling me I got to eat right, I got to exercise. Oh wait, I have to do therapy to understand that maybe I'm emotionally eating, or or whatever may be going on with the mental health that could be contributing to the weight gain, or contributing to the lack thereof. I think the patients that I've had that have lost the most weight
Mhm.
um, have done all the things, seen a dietitian, done
Mhm.
therapy. And some things came up that they didn't even realize. Like they were able to lose a lot of weight, and then they realized that something major happened in their life, and then they wanted to eat their feelings. But the
Mhm.
medications didn't allow that to the
Mhm.
same extent. And so
Mhm.
it was then when they realized I still have work to do here.
Mhm.
And so they started doing therapy.
I love your approach to this. And I didn't fit I thought I really wanted to dig in more of the insurance versus membership
Mm-hmm.
platform, but now that we're here,
Mm-hmm.
I am loving this because this is where my passion is when it comes to obesity and helping people. So
Mm-hmm.
when I first started training 20 something years ago, it was workout. Back then it was Gold's Gym, right? People were
Yeah.
working out, they wanted to be in the gym, it was all about muscle, muscle, muscle.
Mm-hmm.
I realized that people had chronic conditions and they needed my help to live stronger and better.
Mm-hmm.
After a few years and just a few years of training, I was like, wait a minute, it's not the exercises. It's not the exercises. It's really not. And so I had to get deep and just really start paying attention to my clientele and looking at it as like a group of my clients and what are the patterns. And I found that it's about the total wellness. I talk about total wellness. I actually wrote a curriculum, total wellness, for college students. And
Okay.
so, because you have to be able to manage all those other dimensions of wellness in order to stay on your fitness journey. Because I noticed as a trainer that you're not completing the workout, because when you come through my doors and you come here, it's not hard to get you to do the workout. So, what is the real problem? Well, it's all those other factors. It's financial.
Mm-hmm.
What is your financial wellness like? What is your occupational wellness like? What does your spiritual wellness look like? What is your intellectual wellness look like? Do you continue to learn? What are you putting first? What is your family? Are they, every time they come around, they want to go and eat this buffet and all this food, and here you are with them, and that's getting in my way. So I love that you're taking this approach, um, in like with the approach of medication,
Mm-hmm.
because there were clients, I don't know about other trainers, but I know the clients that I had, there were clients that I did want to say, hey, you know you let's go talk to your doctor about a medication option,
Mm-hmm.
because if you were to get a little bit of assistance to get some weight off, that will really help to boost you. One, just that confidence. Sometimes they just need that little bit of confidence, because when they depends on who that client is, from where they come from, if they've never, been small, or how they've been talked to, that they really are defeated mentally. And I used to always keep a cohort with me. I would always have a registered dietitian that I can refer you out to,
Mm-hmm.
a mental health specialist that I can refer you out to. I had a physical therapist. You say your knee hurts, you have 2 times to come in here and say your knee hurts in the same place, in the same type of pain, and you have to go to the physical therapist. And I need him to give me a release form before you can come back and work out. I need
Mm-hmm.
to send you to these other places, because it takes more than just going and thinking that you're eating right. Because honestly, if we're really honest, Every time I told a client what's, something about eating right, it was like
Uh-huh.
a little step, and I'm like, okay, now you need to do now you need now if you really want to get, because then we have to get to where we're taking chemicals out of foods. Then we have
Yeah.
to get to where you're eating chickens that come from somebody's backyard and it's not coming from. It really gets deep. So, it is a journey, and I really want people to understand that and not just really always look for that fast track. And so
Mhm.
I'm really thankful for what it is that you provide at your clinic, Dr. Hall. I
Thank
really
you.
am.
Yeah.
Before we go, I know we only have a few minutes, maybe about 5 or 6 minutes left. I do want to talk about telemedicine. You do offer telemedicine. Am I understanding that correctly? Can you kind of tell me if that's an additional cost, or how does telemedicine work for your clinic?
No, it's no additional cost. He said all of the patients, all of my patients have access to me in person through to video visit, phone or text, and so the individual plan is 125 a month, and like I said, that includes all the access, and and more than that, I think it's the relationship, it's the access to complementary ancillary services like counseling or accountability, right? That's
Mm-hmm.
the other piece
Mm-hmm.
that
Mm-hmm.
my trainers like you are really good at. You can get them there, and you can get on them about where you been or what you eat because you're a little sluggish today,
Mm-hmm.
more so than traditionally we've been able to do in the primary care setting. But like I said, with the way we do things now, it's nothing to have my medical assistant be like, "Hey, this is what you said your goal was this week. How's it going?" So, so yeah, we definitely can do what we do anywhere. And like with the new technology, with being able to get body composition scales just about anywhere, and
Mm-hmm.
with the different monitoring devices, whether it's a smart watch or the new rings that monitor sleep, we're able to get that information into our system, into our medical record, and see how you're doing outside of you showing up here.
So you're actually pulling that information into your EHR?
Mhm.
I love it. I love it. So when they have a telehealth visit, is that via your app, or is it on your website, or how does that work?
It's through our electronic medical record app.
Okay. I
Mhm.
love it. I love it. It's so many other little questions I have. Maybe we can have you back on and
Yeah.
break some things down and talk about one specific. I think that all of my guests have to
Uh-huh.
bring them back and break it down and go in deep into one area. But if you would, Dr. Hall, could you tell everyone how they can reach you if they want to get an appointment? Do you have like a free trial period? You said membership. I'm just wondering.
I don't have a free trial, but I do have a free clarity call. And so they can call our office at 601-658-9343. You can Google Hall Health, and all our information will show up there. Also, you can go to joinhallhealth.com, and you'll be able to find the link to clarity call. So 15 minutes, completely free, and we can talk about exactly what I do and how that works with either with their budget or with whatever they have going on. So I don't give any medical advice at the call, but I do give more information to see if they think it's something that makes sense for them.
And what's that phone number again?
601-658-9343.
I love it. And what is that website again?
It is joinhallhealth.com.
All right. Thank you so much, Dr. Hall, for that. And I mean, it really inspiring information, because I feel a little empowered after talking to you. I feel like I can help my men out a little bit more,
Mhm.
give them some advice. I feel more knowledgeable. I'm glad to know that there are some herbs out there. Herbs can, have a negative interaction with your medication. That was something that I wasn't quite clear on. I'm going to say that. So I do appreciate you for being here. Um, Again, everyone, we thank you guys for joining us. 90.1 WMPR, and I am Astria Goolsby, your host, and we will see you again next week.
Thank you for having me.
Let's get into it. Now I charge per breath. I was overlooked. Now I'm booked past death. Had tables turned. I flipped the room. Now they whisper my name like I'm bad juju. I birthed trends they try to mimic. Did it solo, ain't no gimmick. They took notes while throwing shade. Now they pressed and I got paid. I'm not one of them. I'm one of one. Trying to match my glow. Baby, you're outdone. I'm made for bigger. Now basic. Made for thrones, not fake shit. I don't chase, I check. I don't follow, I flex. I'm made for bigger things. Tell the room I said what I said. Big body blessings, big boss moves. Try me and end up a lesson. They talk about me in rooms I don't enter. I haunt them like regret, make them bitter in the center. I'm that girl, the headline in the smoke. They playing in mirrors, I'm shattering your